Today we are going to discuss the inherited acantholytic disorders, which comprises the two disorders. One is your Darier disease, another is your Hailey-Hailey disease. The common thing to remember, both these conditions are autosomal dominant, so no debate about the genetics of this disorder. If you remember the second names of these disorders, it would be much easier for you to memorize all the topic. The second name for the Darier disease is keratosis follicularis. As it's much evident from the name that there will be keratotic papules, and these papules are in the seborrheic distribution. So very easy to remember by this. In the case of Hailey-Hailey disease, it is also known as chronic benign familial pemphigus. So by this you can remember there will be some blisters or erosions. And it is also occurs in the flexures. There is another striking similarity between both these conditions, that they are aggravated by heat, stress, even sometime UV exposure. And there are some differences between the two diseases. The gene for Darier disease is ATP2A2, and this is ATP2C1. This is present in the endoplasmic reticulum, so SERC-A2 calcium channels, and this is present in the calcium channel of Golgi apparatus. In the Darier disease, you will find the nails red plus white lines. While in the case of Hailey-Hailey, you will find only white lines. In oral mucosa, in the case of Darier, you will find cobblestone or blisters. While in the case of Hailey-Hailey, you will also find erosions in the oral cavity. On histology, there are specific features for both conditions. In the case of Darier disease, you will find corpse ronds and grains. And in the case of Hailey-Hailey disease, you will find dilapidated brick wall appearance. You can remember D for Darier, so D for dyskeratosis. So dyskeratosis will be more marked in the Darier disease. And in the case of Hailey-Hailey, acantholysis will be more marked. So since both are acantholytic disorder, acantholysis will be present in both conditions, but will be more marked in the case of your Hailey-Hailey disease as compared to Darier disease. Okay, these are some important points for picking up the MCQ. Sometime in MCQ, the histology or biopsy findings are not clearly mentioned as corpse ronds or grains. So you have to remember the description also. The corpse ronds are mentioned as rounded disc keratotic cells with the eosinophilic cytoplasm. So these are corpse ronds. And the grains are mentioned as the hyperkeratosis with the pycnotic retained nuclei. So hyperkeratosis with the nuclei is your grains, and the disc keratotic cells with the eosinophilic cytoplasm is your corpse ronds. So you have to remember it as such. Another important thing is that the lesion in the Darier disease, sometimes you find acrokeratosis verruciformis, which is very typical for the Darier disease. The acrokeratosis verruciformis important, and other thing important is Church-Speyer pattern of the hyperkeratosis. So it is also mentioned in MCQ sometime as it is as a line. Church-Speyer pattern of hyperkeratosis. This can be easily remembered by this visual mnemonic. To start with, this is a gate of a gem which is showing CA. CA is for calcium transporter. So Darier disease is a defect of the calcium transporter. And by the start of the gem, there is a play area which shows a fulcrum which is showing A and two swans that represents 2A2. So the defect is basically ATP2A2 gene that is defective in the Darier disease. This ATP2A2 gene encodes for the SERCA-A, which is a smooth endoplasmic calcium transporter 2. When there is a defect of the SERCA-A, there will be defective sequestration of the calcium, which results in the defective adhesion and acantholysis. Next, you can see the round bodies and the grains that are fell on the ground that are showing corpse rods and grains. So these are the histological finding of the Darier disease. Next, this banner is showing less than 20 years of age. So the Darier disease manifestations are mostly in the younger age, in the less than 20 years of age. Coming to the clinical manifestations, you can see the guy in the gym that is doing exercise and he's sweating, and the green sweat is shown in the seborrheic distribution. So lesions are very verrucous, malformed, and foul smelling in the seborrheic area distribution. By this guy, you can remember the lesions of the skin. And the next guy that is shown doing another exercise, that is bar and weight. The shape of the bar is typically V colored. So the nail of the Darier disease is showing V neck, and the weight is showing typical red and white color. So the colors of the Darier disease is red and white. If you focus the mouth of the guy, that is open, that is showing there is some mucosal lesions in the Darier disease as well, and that is shown by the mat, which is cobblestone pattern. So mucosal lesions are of cobblestone appearance. Next character is that female that is carrying the bag very tightly, but there is some debris falling from the bag. That debris is showing the palmoplantar keratoderma. So there is debris on the palms and soles in the form of palmoplantar keratoderma. And by the falling of some debris, there is pit in the floor. That pit is showing palmoplantar pit. So Darier disease has palmoplantar keratoderma and the palmoplantar pit. Female seems to be sophisticated, but maybe she has some ocular problems. Therefore, she entered into the male gym, and the ocular manifestations are in the form of chronic blepharitis or the debris on the eyelid margin or the corneal ulceration. For association, you can see the guy in the background that is doing the treadmill, and he's carrying the bipolar magnet. So with Darius disease, there's schizophrenia or bipolar disorders, and for the treatment of bipolar, you take lithium. So lithium also exacerbated. Next, at the background, you are showing Caesar. So Caesar salad. By the Caesar salad, you can remember the Caesars are also seen in the Darius disease. Next is your treatment. Treatment is shown by this bottles, which are showing topical steroids that are the mainstay of the treatment. And the next can that is showing acitretin. Acitretin is used in Darier disease, but the lesions are very widespread. They are not much tolerated by the patient. And those are our next step is immunomodulators, which is methotrexate. Methotrexate can be remembered by this mighty dinosaur, which is very green colored and mighty in size. So methotrexate is can be remembered by this dinosaur. So here we summarize the Darier disease. Hope you find it useful. And next we will do Hailey-Hailey disease in the next session. And this is the Hailey-Hailey disease, which is familial benign pemphigus, which is remembered as on histology widespread partial acantholysis resulting in the debilitated brick wall appearance, and it is present in the flexural areas, intertriginous areas, presented as erosions or blisters, and it is autosomal dominant, described by the Haley brothers, and it is defect of ATP2C1. MCDs for the acantholytic disorder. The first is 28-year-old male presented in OPD with a multiple foul-smelling, itchy, discrete, scaly, crusted papules in the seborrheic distribution. So these discrete, scaly, crusted papules is the hint for the follicular papules or the keratotic papules. Seborrheic distribution is typical. The lesions aggravated during summer holidays, which was typical. That it is aggravated by heat, friction, stress. What is the specific finding in this biopsy? So the diagnosis is Darier disease. In Darier disease, corporons and grains are typical. Corporons was defined as rounded disc keratotic cells with the eosinophilic cytoplasm. So it's your Darier disease. Next is 31-year-old man presented with edema of face and hands with the yellowish papules in face, temples, and trunk. Hyperkeratosis and fissuring of radial side of fingers, palms, and papules in the buccal mucosa, and the triangular necks. So the clue for this is yellowish papules, which is the keratotic greasy papules in the seborrheic distribution. There is hyperkeratosis of palms, and there is papules in the buccal mucosa, which is the cobblestone appearance, and the triangular necks. All comes for the Darier disease. So no clue for this. Your next MCQ is 44-year-old lady presented with long-standing lesion on the axilla and groin. So again, the flexural distribution or seborrheic distribution. Examination that consists of multiple comedones, deep, painful, foul-smelling abscesses and scars. History of depression because of the illness, and what is the most likely finding in the skin biopsy. So clue in this MCQ is the intertriginous site or the seborrheic distribution site, but something is very painful or the foul-smelling and the very distressing condition. So it can be your Hailey-Hailey disease or it can be your Darier disease. So among the options, the option that goes best with the Darier or Hailey-Hailey is your widespread partial loss of cohesion between the suprabasal keratinocytes, which favors your Hailey-Hailey disease. So 2 points about the Hailey-Hailey disease histology is acantholysis is at the level of suprabasal, which is your spinous layer. And second, the acantholysis is partial. So a partial loss of cohesion is important. So this is the last MCQ summarizing the topic of acantholytic disorders. 7-year-old boy presented with a warty lesions on the dorso of hand, feet, and other extensors for 4 months. Biopsy revealed chert spire epidermis and the hyperkeratosis, acanthosis, and hypergranulosis. So hyperkeratosis, acanthosis is showing this is an acantholytic disorder. or church spire is typical for the diarrhea disease, and the lesions which are present are showing acrokeratosis verruciformis, which is a presentation of the diarrhea disease. So more specifically, A is your right option.